A technique used to get rid of sunspots on your skin can also help save your life. They're called body peels. And tonight you'll see how they can make you look younger and fight cancer. Channel 2's Dr. Max Gomez has more in this special report.
Summertime, 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 summertime.
Okay, so it's not summertime, but if these scenes are familiar, chances are that your skin took a beating back in the days when suntan lotion was mainly baby oil and never a sunscreen. That's what happened to Julie Cohn. She's already had 2 basal cell carcinomas taken off her face.
I wasn't the kind of person who always laid out in the sun, but I like the sun and I like to look, tan and healthy and everything.
Traditionally, people who get skin cancers are treated with an anti-cancer drug called 5-fluorouracil to prevent future cancers. But it leaves you with a red, raw, blistered skin that takes weeks to heal. That's when doctors develop something called a pulse peel that uses alpha hydroxy acid combined with the anti-cancer drug a little bit at a time.
By pulse dosing, and that's why we call it a pulse peel, we can prevent the side effects of the medicines while we get the beneficial effects.
But what if you don't have skin cancer? Chances are you've still suffered sun damage, like Nicole Fagan. She was a real sun worshiper, baking in the sun with little or no sunscreen. But now she's upset about the sun damage on her arms and chest.
I just don't want to look at them anymore because they remind me every day about how I just didn't think.
So why not peel those areas too?
By doing these peels all over the body, and we started calling them just total body peels, we can take away the sun damage, precancers, while also smoothing out the skin, taking away the dark spots, and generally improving the appearance.
So that's what Nicole is having done today. The fruit acid allows the 5-FU to penetrate into the skin. It's applied once a week for 6 to 8 weeks.
It's the 5-fluorouracil that will actually seek out and destroy the sun-damaged cells and leave the normal cells alone.
You can see the results on this patient's sun-damaged legs. As a test, the peel was done just on the leg on the right. It cleared up, while the other, which had just the fruit acid peel, is no better. Julie had her peels 6 months ago.
You don't have to look and expect that you're going to get more skin cancers and that your skin looks refreshed, and it definitely helps with the appearance as well, which is good.
Now, studies have shown that these kinds of peels are in fact a preemptive strike, preventing future skin cancers while getting a cosmetic improvement in the bargain. And better yet, your skin hardly gets red at all, so you can go to work right after the peel. I had these done because as a kid I got a lot of sun damage growing up in Miami. Just a little bit of tingle. Came back to work. I was on the air every night.
Great.
No problem.
Thanks, Max. The upstate city of Schenectady is trying to figure out what to do with a policeman who was called in sick for the last 15 years.